Welcome to the IronRoad Way, everybody. I've already had like 30 seconds with Dr. Blatman, and he is going to blow you away today. I can tell in just 30 seconds of conversation with him. A wealth of knowledge and experience, and is helping people in our community. And our goal today is to get the word out, some of the knowledge out and experience that you have amassed through the years so that we can help more people, so that we can help you help more people. Glad you're here, Hal.
And what we've found in all these years is that medicine is not what we were taught. And pain especially is not what we were taught.
Yeah. So your specialty, you're a medical doctor.
Yes.
And your specialty is myofascial
pain.
Fascial pain.
Right.
So what's that mean?
Well, our bodies are held together by this tissue we call fascia.
Because there are some people, before you go off, that don't even know that Kansas City Chiefs are not in Kansas. Did you know that? Did you guys hear that story? So they may not know what myofascial pain is.
They may not.
Did you hear that story? Truly, it was. Yeah, President Trump said to the great people of Kansas.
Yes, did he?
Yeah, and I'm not saying I'm a fan or I'm not a fan because I like a lot of what he's doing, but he missed that, so they probably don't know what myofascial pain is.
He misses a few things here and there.
We all do. Sorry to interrupt.
So, pain is not what we were taught, and we were started to talk about fascia. Mm-hmm. If you have a steak on your plate, and you take the steak apart, not like your mother told you cut it, don't tear your steak apart, but you do tear it apart because you want to know how it's put together, you'll see a thin film on a microscope around every cell. You'll see a thin film around every fiber. You'll see a film surrounds the muscle and holds it together, and then it comes together to form the gristle that we call tendon. Mm-hmm. Well, that tendon does not attach to bone anywhere in your body. Those fibers or strings of fascia that go through the muscle and hold it together interweave with the fascia that covers the bone that we call periosteum. And then it leaves that and takes off in the next muscle with no interruption. We are one string from head to toe that tacks in and anchors to our skeleton to hold us together. Mm-hmm. And that is so significant because most people who suffer in pain, the pain comes from the injuries to their fascia that have happened through their lifetime.
So is that why you're telling us that what you were taught as a medical doctor is what was different? What did they teach you that was wrong? They didn't teach us about
They don't teach us anything about this, correct.
Yeah.
And so we're taught that pain comes from spine and nerve and inflammation. Mm-hmm. Well, we're designed to have inflammation. We're designed to have inflammation for repair and for defense. If we have inflammation that's causing us pain, we have a deficit, a repair deficit, something injured big enough we can't repair it, and our body has shifted to a defense mode and made us hurt for some reason. Mm-hmm. If you don't eat anything that's inflammatory to your body, most all of your little injuries that happen through your day will get repaired under your radar, and your body will never even tell you.
So we were made for inflammation.
We were made to have inflammation
Yes.
for repair and defense, things that are there to help us
Makes sense.
through those things.
Gotcha.
It's not necessarily there to cause us pain. Pain is an over-the-top thing.
I got you.
And not something necessarily to be defeated because it's helping us heal.
So when you're eating things, drinking things that cause inflammation, you are artificially raising inflammation.
Yes.
That when your body goes to try to heal itself naturally,
makes more pain and lights you up like you plugged in a Christmas tree and all your wounds are right in your face instead of under your radar.
Wow, that's fascinating.
Yes.
So talk to me a little bit about how you discovered it before we get into the practicality of how you're helping the people that get to see you now.
It was a long time ago. I started in orthopedic surgery.
Yes, I read
left
that.
the training program after a couple years and started working for an urgent care office. Mm-hmm. A dentist walked in and asked me if I'd ever heard of TMJ syndrome.
Yeah. I was told I had it once.
This was back in the dark ages of medicine before anybody really had heard of it.
Right.
And he proceeded to teach me how you could touch structures inside the mouth, neck, jaw, and reproduce the pain of somebody's headache and face pain. And I never looked at headaches the same way again.
So what year?
That was 1982.
Okay. And so just by him telling you how to touch different places on your face.
And inside the mouth.
And inside the mouth, he could replicate
headache pain. Because the headache doesn't come from your head and doesn't come from the blood vessels like
so it's
we were
referred.
taught.
Okay.
It comes from the muscles and fascia injuries through your lifetime that involve your neck, jaw, face, and even upper back.
So fascinating. My wife and I drove Wednesday to Worcester to watch our son play basketball. She has horrible headaches. Terrible headaches. I mean, it's debilitating.
Yeah.
And it's the way she explains them coming on is it's always in her neck. And so this is myofascial pain.
The injuries to her fascia that started maybe in her birth canal or through childhood. Mm-hmm. And then the food that she eats is inflammatory enough that these strings in her neck that are knotted and kinked, that pain exacerbates and goes all through her head in various patterns. And we call these headaches migraine, tension, cluster. It doesn't matter what you call them. They're all the same.
It's amazing to me, and it's obviously a gift that you've been given. You know, from my perspective, it's God giving you a gift. Somebody shows you, a dentist shows you different places that you can press on the mouth, recreate a headache, and a light goes off for you.
Well, the light went off for headache at that point. And so all the patients that came into this urgent care office with headaches, I referred a lot of them to him, and they were ultimately helped. But I didn't put the pieces further together yet.
Yeah.
Several years later, I was given a monograph written by one of my mentors, Dr. Janet Travell. And she was one of Kennedy's physicians when he was in the White House for his back pain.
Is that right?
Yes.
And what, I'm sorry, what did she give you, Hal?
Well, a medical director of an urgent care I was working for at that time gave me this monograph, 34 pages that she had written.
Okay.
And a few weeks later, I was working in a clinic in Delhi, and this woman came in with pelvic pain. And I examined her, and everything that in my training said this is pelvic inflammatory disease, intravenous antibiotics, ambulance ride, directly to the hospital. But it didn't fit. And rather than trying to make the data fit, I looked at her looking very much like Dookie Howser in those days. And she was 20.
I can see that.
Can you see that? And she was 20 years my senior.
Okay.
And I said, instead of the intravenous...
Tell the millennials who Doogie Howser is.
Dookie Howser, he ended up being a doctor looking like, and at 16 years old. Something like that, right? And they'd have to Google and look it up and maybe watch
Look
a
up
YouTube
Doogie
video.
Howser.
So I suggested to her that rather than the pelvic exam and the IV and the scenario, what if we stretch out the muscles in her belly and see if this goes away? And her being older and me looking like Dookie Howser and her not wanting to go to the hospital, it didn't take her long to say yes.
Yeah.
So I went in my briefcase and got out the monograph, and I laid it on the counter behind us and got her on the treatment table. And there were diagrams with X's and arrows and things to show me what to do. And I put her body in those positions and stretched out her fascia that would make that pain pattern. And about 5 minutes later, all of her pain was gone. All of her tenderness was gone. And I was adjusting my overalls, trying to figure out what it was I'd done.
That's amazing. Absolutely fascinating.
And I don't believe anything I can't see, touch, or feel. Got her phone number, permission to call her, called her back in a week. Pain was still gone. So I read the rest of the article.
Wow.
And then my dental buddies told me what I needed to buy. The clinic I was working for humored me. And they bought me dental syringes and the tools of the trade. And working for this urgent care, I taught myself myofascial pain in the next year and a half.
What a gift you've been given. So
tremendous gift. Yes.
It's just a gift. And so, what kind of ailments are you? I'll give you two examples, and
okay.
that you can talk to. I think will be a springboard for you to talk about. I've got a daughter with Crohn's, and I personally have some type of esophagus issue. What made me think of it was when you talked about putting this lady on an antibiotic. I'm supposed to take antibiotics and anti-inflammatories for 2 weeks to deal with something that I've got going on with my esophagus, and they want to obviously do a scope.
Wow. So there's a lot modern medicine needs to do, and we have wonderful tests that can show us when we are getting into real trouble. But we also do things to people because we miss a lot, and there's a lot we don't understand.
It's probably ignorance, right?
Yeah.
Not in a negative way. It's just
and
ignorance.
Pain is a big one. Would you like to see the touch piece? Can we demonstrate on your elbow?
Yeah, I love it. Yeah,
let's
absolutely.
Come and sit around. And this elbow is not painful. One of the things that I'm trusting you. It's not painful because I'm going to tweak it a little bit.
Got a shoulder issue, but no.
One of the things to really be keen on is that at the higher end of this skill, I can touch your body, and when I touch you, we're examining you together. And by the texture of your fascia, tell you where you're tender and show you where your injuries are through your lifetime with an interesting degree of reliability. So watch this. I can touch this and tell you that's tender, and this is tender. I can touch up here and tell you that's tender. Watch your talking finger dance. See that move? You know why they call that the talking finger?
Yeah.
You know, if you put it up in the air, it says a whole sentence or at least a couple words. If you
can we make it talk again just for the audience?
We will. But if you put a Band-Aid on it, it speaks with an accent. Okay, now, so the talking finger, the muscle that makes that move, starts up here. It's more ropey and more tender here, less ropey and less tender here, and gone there. This texture is not tender, and this texture is. And by your texture, I can show you where you're injured through your lifetime.
Absolutely.
The reason that this is tender, remember I was telling you about the strings of fascia that go through the muscle?
Mm-hmm.
The reason this is tender is because the strings that go through this muscle right here are tied in a knot. And that makes this ropey band that makes this finger move. And the nerve endings in between these strings are squished by the knot, and then I added my thumb. Over here, you have the same strings and the same nerve endings in between, but there's no knot. I can't push hard enough on this to make it hurt, and that's why this texture is not painful. Here's the injury that made it happen. Ready for this? Mm-hmm. That's tender. Mm-hmm. This is tender. That's tender. This one's tender. That's not. All through here is where these strings weave to your body. And all through here is through your lifetime where you've pulled them loose and injured them. And when the cable snaps, the strings get twisted into this kink. And if this kink is big enough and bad enough, it makes you hurt from here all the way down to your hand. Would you like to feel another one?
Yes.
Okay. So
I'm speechless. I'm never speechless.
Check this one right here in your neck. This is tender. All right.
That's tender.
The injury that caused it is right there.
That's always.
Feel how tender that is?
It's
Now, this part is not tender. A millimeter, 2 centimeters away, that is tender. Mm-hmm. How'd you get that? Well, there are many places that through your lifetime could have happened, but one of them could have been in nursery school. Sally, you made her mad when you walked in the door.
I made a lot of Sally's mad.
Right before recess, she came up behind you with no warning and did this and snapped your head back. You tore this string, wound it into this kink that you'll wear, causing you migraines possibly for the rest of your life. Now here's another one. There's no muscle in your body immune. Check this one out. You got one right here too. Feel that? Mm-hmm. When you got up off the floor and went behind her and pushed her back, that's when that one happened. Now, maybe that's not true. Maybe it was the car accident. Maybe it was all the push-ups you did trying to pass the president's fitness exam when you were, in 10th grade. Who knows? Mm-hmm. But these injuries through our lifetime are what cause the pain that we suffer from today. And it's not magic, and it's not intractable. Mm-hmm. And almost at least 90% of the time, we're finding most of it can go away.
See, so people don't understand it. And so
neither do my colleagues.
The easiest thing for them to do is dismiss it.
Or to tell you it's in your head.
There you go.
Or to tell you you're a drug addict because nothing works for your pain except the medicine you're now not allowed to take.
Unbelievable. I mean, absolutely.
And the medicines you are allowed to take, and everybody wants you to take. Let's take ibuprofen, for example.
Yeah.
The best thing that ibuprofen does for people is to reduce the inflammatory reaction in their body from the food they've eaten that they should have never put in their body. Okay? Mm-hmm. And in order to do that, it causes you kidney failure, ulcer disease, stops you from regrowing and restoring the cartilage in your joints from daily wear and tear, and heart attacks. Really?
Ibuprofen?
Every single one.
Taken in.
Aleve, ibuprofen, Celebrex, the whole family does that.
Gross amounts.
No. I listened to a nephrologist, a kidney specialist, tell me he's seen more people on dialysis from ibuprofen than from diabetes, and it only takes one in an unlucky person.
That's hard to believe.
Yeah.
Just because they're So
those drugs by prescription, there was an article several years ago looking at over a year's period, more than 100,000 hospitalizations, and I think 15,000 deaths in this country in 1 year from that family of drugs.
that's hard to believe.
And they're over the counter.
Unbelievable. So it all comes down to money, right?
Well, a lot of things come down to money, but it also comes down to people in a lot of pain looking for a way to get out of pain. And nobody tells you you need to change your food.
Yeah.
Everybody tells you, Noop it, take some Advil, do this, do that.
Mm-hmm.
And think we in our research, we look back and go, does that really make sense? Should we really be doing it? And try to rethink these things. Here's a common one. Do you put ice on your ankle sprain or do you put heat?
Ice it.
Right. That's what everybody tells you. Mm-hmm. What does your body do to your ankle when you sprain it?
Sends all the blood there.
Does it warm it up or cool it down?
Warms
it up. Why? Don't you think, after all the years our biology has been in existence, that through natural selection, if that ever really happens, that our body would have learned how to heal our injuries as best as it could without going to the hospital?
Either that or maybe it was designed that way.
So let's just take the argument. Does your body warms that ankle up?
Yep.
Why does it do that? It warms it up to speed up blood flow, increase circulation, and speed up healing.
Mm-hmm.
Why would you ever want to slow that down?
That's fascinating.
The only thing I ever put ice on is a burn. If you put ice on your ankle, you just limited your capacity to heal. You put ice and ibuprofen on your owies after you just played your sports thing as a weekend warrior, you've just turned it into a chronic injury and stopped your healing.
That's amazing.
What should you do instead? Speed up your healing. How would you do that? Go home and put heat on it and squeeze out the swelling as fast as you can.
So what are the most... give me an idea of some of the ailments that you're treating.
So
are they all over
let's
the
say
board?
you have a rotator cuff tear.
Yeah, I think I do.
Okay. And you want to know how to know?
Yeah.
We can show you right now.
Yeah.
Bring your shoulder over.
Oh.
So
I might not like this.
It won't be bad. You'll live through it.
Okay.
But John Wayne said it best, and I don't do the best John Wayne, but I like
Let's
it and
hear
I remember it
Give
this
it a
way.
Shot. Let's hear it.
A tender tendon is an injured tendon, Pilgrim.
Yeah.
And them that's more tender is also more injured. All right.
That wasn't bad, kid.
Not too bad. So hold this.
There's about
Hold this
5.
right there. And here's a tendon in your shoulder.
Yeah.
And this is tender right here.
Yeah.
That's an injured tendon. And here's another one right there.
Yeah.
And this one's not as injured as this one because this one's more tender.
I don't know.
You don't know?
That's sore.
Yeah.
So is the other one under there.
Yeah, it is more painful, isn't it?
Yeah.
Okay, so you've got a tendon that used to look like this. You can rest. Used to look like this. And now you're some version of holes in it or thinning.
Mm-hmm.
And if you take that to the orthopedic surgeon, his best effort is to cut this out, trim back far enough to get to a reasonably healthy compromise, but that's part of the injury too.
Right.
And then drag this up and anchor it to the bone and send you
Yeah.
to physical therapy to figure it out.
Yeah.
When you skin your knee, you bleed, you make a scab. 4 weeks later, the scab falls off and you have new skin underneath, pink at first. Takes a couple more weeks to get the right color. If I take blood out of your body, concentrate the parts that would make the scab, re-injure this tendon by poking it with a needle so your body knows it's got work to do and otherwise it doesn't have a clue, and put that stuff from your blood in 4 weeks when the scab falls out, you have new tendon holding you together. It's that simple.
It's hard to believe.
And so if we can find your injuries by your texture, and we know where and how to get your body to repair them, because we don't fix anything. We get your body to fix itself as quickly as it can.
Got it.
Souping up and biohacking your healing systems to work where they otherwise wouldn't have the speed, power, or age to be able to do by themselves.
Right.
And we can help an 80-year-old heal a rotator cuff tendon.
That's incredible.
We can help even a young or an old person regrow cartilage in a worn-out joint. You don't have to replace the joint. X-rays correlate with motion. They don't correlate with pain. If you can still bend your knee 90 degrees, there is no possible way it's bone on bone. It only takes 3 cell layers of cartilage to get a joint to move. You can't see that on an x-ray. That takes a microscope. But if you can move this far your knee, you don't need a new knee.
So are most of the issues that you're treating then, are they orthopedic in nature?
Because
or
we
are you
also
treating Crohn's, for example?
Yes. With Crohn's disease, we're going to show you what to eat. We're going to show you what supplements to take to try and rehabilitate the lining of your gut.
So what happens if you've got a girl that's been through it all? Okay. So started at 14. This will be a good case study. I'd love to hear your thoughts on this. Started at 14 and has had really the only drug that she took that she had success with, she was a 1 in a million response to it. So it was either her liver, I think it was her liver, responded in a way that they had to stop it.
Okay.
And so she was experiencing some relief with that drug, but outside of that, nothing else worked for her.
Right.
So last resort, which I find out is the first measure of treatment in Europe, is let's put in a feeding tube, cut off all eating. My wife actually did the research on, instead of taking what the hospital was going to give her, which would have been full of sugar, my wife says, no, let me do some research. She finds a company in Dayton. It's all natural.
Yes.
You know who I'm talking about? So they start feeding her tube. 8
Real
weeks,
food.
8 weeks, nothing. 8 weeks of just no food through the mouth. She could put something in her mouth, chew it up, and spit it out. And for the first time, she's 22, in 8 years, she feels good.
How about that?
She feels good.
Why?
I don't understand the science behind it, but my guess is I've removed whatever the body was having to do with the food that was putting in it, she was putting in it. I've removed that
You've
process.
given her nutrition without the poison, or the things that we're going to use poison as kind of a big term, but to her body, some of those foods were poison, and her body's not able to defend it, so it makes holes in her colon. Makes holes in her intestine.
So there was something. So you're if I'm sitting there with Allison and Dr. Blatman, the first thing you're going to say is there's obviously something you're putting in your mouth that your body doesn't like, and we got to figure out what that is.
Yes.
Yeah.
And
Children's Hospital doesn't talk about that.
No, and it's unfortunate.
Yeah.
And not all nutritionists are taught about it, and medical doctors are taught very little about it.
Yeah. No, they're taught how to treat
this stuff
it with
that
medicine.
we call probiotics.
Yeah.
We were putting people on probiotics in our practice 25 years ago.
Really?
Yeah.
And that's what in mainstream? What is that mainstream?
It's not even mainstream yet.
Really?
But progressive people.
Because you start to see it.
Yeah.
What's the stuff called? Kamuka or Kambuka?
There's all kinds of things for
but I've seen that one, so I've heard of it. My wife.
People now know to eat yogurt when they take antibiotics. But that's only in the last 5 years or so. And
okay, that's
there's
what
lots of people that don't know that. Yeah. We've been doing that for 25.
That's fascinating.
We've been doing most of this for so long.
So what would you have done for
your daughter?
Allison?
Gluten-free, dairy-free, sugar-free. And it's interesting. People go, well, I'm mostly gluten-free. And when you're sick and you've got a real issue, there's no such thing as partial credit. Because that tiny speck of molecule that you put in your body sets off your immune system for more than 4 weeks.
Allie, are you listening, Dr. Blatman?
And up to 4 months.
Tiny.
That's
all it takes.
You get no partial credit.
See, because you know that is the differentiator right there. In her mind, she's thinking, I'm 99.9% good.
That's great. And that
There's
0.001%.
That explains why this works.
And she got nothing for 4 months, and it takes 4 months to settle down her body. Yeah. Now she needs to most likely never, put that stuff in her body again.
Guess what happened?
She went back to eating and she got sick again?
Well, the tube's still in.
Mm-hmm.
Well, yes. In a nutshell, yes.
Right.
But they start reintroducing small bits.
And what did they reintroduce?
That I don't know for sure. But they said, try this. And she's right back in the soup. Not nearly as bad, but she's back in the soup.
Right. Now, if she introduced anything on the universal to our species do not eat list, as we term it, and you can get that do not eat list by going to our website.
Yeah, tell us.
www.blatmanhealthandwellness.com. And from there, you can sign up for our newsletter and download what we call the do not eat list.
And if I'd have known this, first of all, why are we not partnering with you from a wellness standpoint? I mean, we've got 8,000 people that we're self-insuring that need to hear this. I mean, it's crazy. We got to figure this out.
Not only is it important from that standpoint, but you're self-insuring these people. You lose when you self-insure if you have big bills to pay.
We got a major It's the absolute biggest exposure that this company has.
If you devote a significant part of the resources we could create to the people that will cost you the most, and you, by getting them healthier, stop that sieve from losing, you've changed your entire model.
Yeah, we've changed the entire model. But here's the thing. I mean, it also aligns with who we are, right?
Yes.
I mean, if we've got something that we get convicted about that we think works, it's a no-brainer for us. Absolute no-brainer.
And that's who I am too.
Yeah, I believe
to help people to get better, to be able to do things for people who have no hope, who've been told that there's no hope for them and they have to live with this pain for the rest of their lives. That's nonsense.
How long have you been doing this?
30 years.
Pick one or two of your best top stories, things that you've had people come in and
I've got one I just love.
Yeah, let's hear it.
A woman comes to us, she's in her early 30s, and she's got severe rheumatoid arthritis. She's had it for 10 years. It started with too many vaccines for whatever, sometimes that might happen. And by the time she comes, her fingers are going sideways, her knuckles are swollen and red. An x-ray of her elbow, so much bone loss, you can't see bone on the x-ray, but you know there's an elbow there. And she's got pain all through, and she won't let you move her arm. She moves it by herself. And I have to work on these muscles while she's holding her own arm. She's been with us about every 6 to 9 months over the last few years for 4 days of intensive treatment. So when people come from out of town, they often come for 4 days at a time. And in those 4 days, we do herbal medicine, platelet-rich plasma, trigger point injections, stem cells, everything that we know. And now it's 3 or 4 years later. Her fingers still go a little sideways. Her knuckles aren't so swollen. She can wear gloves she hasn't been able to wear in years. She goes to her massage therapist and she has a few places that hurt instead of all over my body. And when we saw her several months ago, she could move her elbow on her own without using the other hand. And she could take off her coat like that without worrying about the pain. And she can work 2 jobs and she's no longer an invalid.
Unbelievable.
No biologics, no steroids, no cortisone, but her diet is crystal clean. And she's done everything we've taught her. And thankfully, everything we've taught her has worked.
Do you have any people that come that follow your plan that are not helped?
Yes. There are a few people, very, very few over these 30 years,
and
that have done everything I've suggested and nothing's worked, and I haven't been able to figure out. And I wish I had a crack at some of them again now that it's this many years later. But there's very few misses on the people who work at it and try.
Were they specific? Was it a specific area of the body that was more difficult? Or no. Yeah, gotcha.
And this is headaches, foot pain, migraines. Pelvic pain is a big one. Whether in a man it might be called prostatitis, in a woman it could be called vulvodynia. It could be called
what if you can't
pudendal neuralgia of all things, and it's rarely the nerve.
So the prostatitis
that is not infectious.
5 times a night. 5 times a night.
There may be things to do to help that. And if it's painful, the pain's usually not coming from the prostate. And in women, and sometimes men, they're diagnosed with interstitial cystitis because we think it's the bladder causing the pain. Sometimes it's the bladder, but not most of the time. And there's fascia around the thighs and belly and back and butt and pelvis that contribute and make these things hurt that we're never taught how to look for. And you can't find it if you don't look for it. And to emphasize the part of not looking and examining, people who've had surgery on their knee or on their back or their spine or their neck, most of these people, the surgeon has never, ever really examined and touched them. Poke them, check their range of motion, check their ligaments, but to touch them like I touched your elbow It just doesn't happen.
So here's the key question. I hope and pray that you've thought this one through, because it's really the key, from my perspective, in allowing this phenomenon take place through you. What's your perpetuation plan?
Oh,
who
I
else
teach.
Who else are you training? And are there other people out there? I listen to you talk, and the way I would explain it is I see it. It's coming from the inside out, right? I mean, you can tell when you can tell. You've experienced this. Something's been given to you, some type of gift based on lots of different variables. And so all I can think to myself is, okay, I've got to get my daughter to you. I've got to get my wife to you. I've got to get to you. And oh, by the way, I'm going to go on record right now as saying we're going to figure out how to partner with Dr. Blatman here and begin to impact the people that are working with IronRoad. Period. End of story. We're going to make that happen.
So how to?
But then I think, how do I have you touch 8,000 people? You can't.
I have to teach the touchers.
How many other people can do it?
There's probably about 100 people that I've taught how to do most of this work. We had a training center in White Rock, British Columbia. We've taught people all over the country. We have a training center, and we work and teach people in Cincinnati.
Mm-hmm. Are there other people in Cincinnati?
And I teach in a medical school in Seattle.
Okay. So are there other people in Cincinnati that can effectively
do this at this level?
Yeah.
There are people in Cincinnati that are really good.
Yeah.
There are lots of people who have bits and pieces and parts of this.
Yeah.
Massage therapists even has part of it.
Mm-hmm.
But
I can see that if you're touching the fascial.
You know, I've done so many things in my training period. Anytime I saw something and didn't know enough and there was nobody to refer to, I went and took it on and learned it.
Mm-hmm.
Anytime I saw something that really piqued my curiosity, I took it on and learned it. Mm-hmm. Here's an example.
But you're uniquely gifted. That's part of the problem.
But that's why you're not going to find somebody like me in Cincinnati.
I get it.
Yes.
Right.
But people can follow the path. I got very interested. My wife came home. And she said, there's a physical therapist you need to meet. I've invited her over for dinner.
You're going to meet.
This
Not
was
need to meet. She's coming.
Was 1990, and she comes over for dinner, and she opens with telling me my skull bones move. And I said, well, maybe yours do, but I went to medical school, and mine fused when I was 2 years old. By the end of that evening, I knew that skull bones moved, that nothing ever fused without pathology, and I could feel it with my own hands. I was so curious about that I went on over the next couple of years to take enough craniosacral therapy courses that I am a craniosacral therapist. And then I learned that you can feel energy levels off body. And Bonnie, the woman who invented healing touch, lives in our town. And I took enough healing touch classes that I'm a healing touch therapist.
The healing touch, do they do that at TriHealth?
Yes. I was part of the group that helped start that way back when. There's so many things like that, from pelvic pain to myofascial pain to learning about energy to learning about herbal medicines. Bioidentical hormones is another one. When I first started with bioidentical hormones, I'm treating pain. Women were being put on Premarin by their obstetrician and gynecologist. Well, estrogen by itself is neuroexcitatory and makes the nervous system ramp up in pain. And there was nobody figuring out how to stop that. So there were other doctors worrying about how these drugs caused cancer in people. I was worried about how they make so I can't make their pain go away. And I started to learn bioidentical hormones. And after about 5 years, because nobody was doing it back then, I thought I'd figured it out. And about that time, search committee calls me, and a month later I end up as a board member of the American Holistic Medical Association, which I later became president. But as a board member, I met this woman, Lisa, also on the board at my very first board meeting, and she was an expert in bioidentical hormones and co-owned a pharmacy, making them, and had done it for herself and really had figured it out. Mm-hmm. And there I was in the lecture at my opening meeting in this organization as a member of the board, not paying attention, sitting way in the back at the keynote address, speaking for an hour and a half with Lisa, where she took apart everything I'd learned on my own about bioidentical hormones in the previous 5 years and spit it out in a way that made sense. and taught me in the next 5 years under her wing how to do bioidentical hormones like nobody I've ever spoken does them. I don't use skin. I don't use needles. There's another way to do it that's more physiologic and works in a lot of people. Mm-hmm. And there's so many ways to do it, but I have taken on all these pieces that if there was no way to learn to send you and refer you, and we really needed it in Cincinnati, I went and learned it. And so that's why I have this diverse background. And one of my gifts is to be able to see a complicated, complex person and be able to put the myriad of pieces together because I'm not just in a silo. And from my presidency and from the things I've done teaching internationally, I have a wide variety of resources that I can call when I'm stumped. Because somebody in the country most likely has seen something that's close enough to what's stumping me that to stimulate some piece of creativity that can help. And that gives me hope to help even the person that can't find that hope anywhere else.
Man, wow. Absolutely fascinating. Can't thank you enough for taking some time to be here with us. We're going to have you back.
I can't thank you enough for the venue to be able to share this knowledge because people really need to know.
Oh, my goodness. It's unbelievable. And we look forward to helping the platform that you've started get to a different level, starting with our folks here. I got to get my wife over there.
That'd
and
be
my
great.
daughter over there.
That would be great.
Yeah. Dr. Blatman, can't thank you enough.
Pleasure,
Thanks
Billy.
for being here.
Thank you
Enjoyed
so
it.
much.